So here's my emergency kit container, and now I'm going to show you what's in it. Okay, so the first thing that's in my emergency kit container is the ammonia inhalant, and I'll show you that. And what the ammonia inhalant is used for is it's used for patients who have lost consciousness, so they're unconscious. And what you would do is you would take a little ammonia inhalant and you would put it under their nose so they could smell the ammonia, and they could, stimulate consciousness back. So how I made this was, it's like there's a Reese cup egg in there, and I just wrapped it in paper. Also, an ammonia inhalant is also known as a smelling salt. Like I said, if you had a patient who was unconscious, you would put the smelling salt under their nose and they would smell the ammonia and hopefully stimulate their consciousness back. So the next thing is my epinephrine pen, as you can see. And I tried to think of something that had like a pointy top to like stick in the needle. So with an epinephrine pen, these are used for patients who have an allergic reaction. Like a patient comes in and has just got stung by a bee, and they're highly allergic to a bee, and their throat is swelling up, or they're experiencing hives, things like that need medical attention. And so when a patient has an allergic reaction, their body needs epinephrine, hence is why this is called an epinephrine pen, also known as an EpiPen. How this is used is you would pop the top of the epinephrine pen. Of course, this does not look like an epinephrine pen, but you kind of get the idea that the needle would come out right here. So you would just pop this off, and you're going to stick this into the meatiest part of their body. Normally, the injection site is in their thigh, the meatier part of their thigh, so maybe on the side, and you just stick that in, and the epinephrine automatically is injected into the skin to stimulate the allergen. So the next thing is the diphenhydramine, which is also known as Benadryl. I'll show you that. So this is my little Benadryl container, and I used Sour Patch Kids, so I will show you that too. If I can just get this container off. So as you can see, the Sour Patch Kids in there. Benadryl relieves the symptoms of the allergen, so it prevents the patient from experiencing nausea or vomiting or even dizziness. Sometimes people take these whenever they have really bad allergies. Sometimes Benadryl can make you really sleepy, and it's just a pill, and so you would just take, the recommended dose with water. The next thing is the nitroglycerin, and this is my nitroglycerin, so you can see it, and this is cooking spray. Nitroglycerin is used with patients who have angina, which patients who experience chest pains. Always know that whenever you have a patient experiencing chest pains, you should take it seriously and act as if it was a heart attack. And so the nitroglycerin either comes in a spray or a tablet, so they could take it or they could spray it in their throat, and it relieves chest pain, and hopefully it will make them comfortable. Okay, so my next thing is my albuterol, which is this little Pez dispenser. This is not what it looks like. Albuterol is normally in an inhaler, and it's for people who experience really bad asthma and asthmatic attacks, and any kind of symptoms that you see, such as wheezing, shortness of breath. You need to, alert your patient if they have an inhaler, or even your dentist office has an inhaler, to give it to them. How the inhaler works is it opens kind of like this, and you would stick the tube part in the patient's throat, and they would just push the button, and it would give them breaths of air, which is albuterol, is the breaths of air. The next thing is aspirin. This is my aspirin, and it's in the bottle, and okay, it's M&M's. So as you can see, oops, dropped one. Aspirin is used as a fever reducer or a pain reducer. So any of your patients that are experiencing like muscle pains, headaches, or toothaches, aspirin is always good to use. How you would use this is it's just a pill, and you would take the pill and just swallow it with water, your recommended dose, as it says on the bottle. The next thing is Tylenol, and I'm sure that you've heard of Tylenol before. It's used as a fever reducer and also a pain reducer. So if you have a patient who has a headache, a muscle ache, arthritis, a backache, a toothache, colds, or fevers, it's always good to just give them a little Tylenol. And it's also a pill that just make sure that you're taking the recommended dose with water or liquid. The next thing is my cake icing, as you can see. And the cake icing is used for people who their blood sugars have dropped. And so if they were to lose consciousness, or if they just don't feel right and they can't tell you that they don't feel right, you would just squirt a little bit of the cake icing under their tongue, in their mouth, just so they could swallow it to increase their blood sugar. So that is my emergency kit, and I hope that you have one in your office as well. Thank you.